I wanted just to spend a few moments talking about clinical supervision and why it's so important for today's practicing mental health nurses and the registered nurses who work in the trust. Clinical supervision is all about reflecting on your own professional and personal interventions and your own development. Without actually clinical supervision, how can we say that we are really caring and responsive and supporting our patients' recovery? I know people are challenged about how can I find the time, but in actual fact it's now a must-do activity and not something that's an elective. Clinical supervision is a fantastic opportunity to reflect on what you do well as challenge you to consider what you could do differently. Sitting in peer supervision, for example, gives you a wonderful way of problem solving some of perhaps the engagement issues you're encountering with some of your individuals that you're working with. It can also help you to consider different ideas and also adopt some of those ideas from other practitioners. It can also be amazingly morale boosting to have your colleagues tell you that you are actually doing something well and actually being able to say, I am acknowledging that I've done a really good piece of work with this person. We also know that if you actually undertake supervision and you do it routinely, we know that there is now emerging evidence that it's not just morale boosting, but it can help retain you and support you in your own practice. And that's what we really want to do and help you stay here to think that that's the best way to deliver your care in the trust. I have invited members of the development group to highlight how supervision helps them in their practice and why they're actively engaged in the development programme that we are now collaborating with the London South Bank University. I'd like you to listen to what they have to say, and then we can reflect afterwards around actually how to become a member of that development group, as well as considering what part can I play in ensuring that we take this forward and make it an integral part of our everyday practice.
The reason as to why I was really involved in this program is because, to be honest, I graduated about 2 years ago. And when I joined the trust, yes, I was receiving supervision as a HCA, but here I was given a role to supervise something that I had not done before. And nobody had sat down with me and told me, Samuel, this is what we do. So having an opportunity to come and see, maybe get some people there who are experienced, talking about what they normally do, it will give me a clear picture of how I can go about supervising the others. It's not about me just looking at the supervision policy and start using that as a way of supervising my supervisee, but it's also about looking at how the experienced staff have been able to support either the senior or junior staff, hence have a productive supervision as opposed to me just filling in the forms and making sure that I've ticked the box. So being there was like, okay, I've listened to my colleague, this is what he has done, this is what he's doing. It gives him a kind of more skills that I can use. It's kind of making me kind of more multi-skilled in the way that offers supervision to my juniors as well as, if possible, my seniors.
Just from my experience, I know that clinical supervision is extremely important as a clinician because for me it's a platform where I can reflect on my practice. I can sit with my supervisor and look at where things are going right and where they are going wrong, and come up with a plan on how to act on that and to improve on my practice as a clinician. Supervision gives you that platform to actually kind of improve on your practice by identifying any needs that you might have. If there's something that you're struggling with, you can identify maybe some training needs, and in that aspect you can go and improve on your skills, and by doing that you are able to provide even better quality care for the clients. And for me, that's kind of the most important thing as a clinician.
And I guess where I see it is having a space where you can just reflect on your clinical casework that you do if there's issues that come up. Because aside from managerial supervision, you sometimes don't really, you get some, I suppose, opportunities in team meetings to talk about things, but it feels like you haven't really got a lot of time to expand because you're sharing that space. If it's like a group thing, or even individually, you've got a number of cases to discuss, and there's a different agenda, I suppose, sometimes of those sort of meetings. Whereas with clinical supervision, you can either have the option of doing group clinical supervision or doing individual. So then you can actually prioritise how you're going to use that time to discuss particular issues that you want to spend time reflecting on, and maybe get some guidance with making sure your practice is safe, and I suppose in a way you are offloading maybe some of the feelings that your work engenders sometimes with clients and carers alike. Kind of come back with a fresh approach, and yeah, we feel reinvigorated in the work that you do and feel more confident in the work you do because you've actually reflected on it in that space.
Joyce, talk me through why you have become involved in the development programme and why you think that clinical supervision is so important for mental health nurses.
I feel, having worked in the Trust for many years and having worked in different areas of the Trust and being a community mental health nurse, a lot of the work we do is very important. We support many people through difficult situations. We support other staff members, but we tend to forget ourselves. Other disciplines in the Trust, they get supervision, and having supervision makes you an effective person because you can think through a lot of your interventions and think through a lot of maybe mistakes you have made to try and be a better clinician.
So having supervision is like, if I use an analogy, it's like you have two eyes, but you have another third eye just to look at you and say, okay, Samuel, what you're doing is right and what you're doing is wrong, and how can I improve on what I've done wrong? And if there are things that I'm doing right, are there any other ways that I can make them even improve further? So supervision gives you that opportunity to look at everything as in your practice overall. And number two, I remember some times ago when we went for that training, and I don't remember the name of the lecturer, but she was saying that one of the staff members walked to her and said that she feels like walking around with a machete just to slash the patients. Mm. I don't go to that extreme, but that feeling is there. Mm. You find that in as much as you're providing care to the clients, some of them are not appreciative, and all the time you're being abused and abused and abused. And if you just get that small opportunity to go and sit down somewhere, just to cool off, I believe supervision is the place to be, if it's possible. Yeah.
Can you give me an example of where a particular somebody that you're working with at the moment where clinical supervision would really help you in relation to their engagement, or is there anybody that you can think of that where that's really helped?
I have. When I came in, I was a little bit new, but I was given an opportunity to supervise one of my junior staff. There are occasions I was really worried about the comments that were coming from my colleagues, and I thought maybe it would be an opportunity for me to have a chance to sit down with this junior staff just to look at what's going on, what's happening, and whether she realizes that whatever that she's doing sometimes does affect the whole team. I've had an opportunity to sit with her on a few occasions, but it's something that is ongoing. It will be a very difficult thing because I remember sometimes when I also went for the training, I said that there was an issue to do with gender, whereby I felt that she was not happy to confide in me some of the issues that might be affecting her in relation to what she's doing. And she said that she would prefer to have a female supervisor as opposed to a male supervisor. And I was trying to find a way of maybe breaking the ice so that maybe she feels like even if she goes to a female supervisor, it will be the same thing that she'll be receiving. We still have issues, but I hope down the line she'll be able to maybe to come up and say, okay, Samuel, I'm working and I believe you're the right person to work with me in terms of supervising me. But it's still an ongoing issue, yes. Yeah.
I'll give an example. For instance, I moved from adult mental health to older people, and one of the difficulties I found was dealing with death, because you work with people, you get attached, you support their families, you become part of that care. And for instance, yesterday I got shocking news when I went to visit someone that they had passed away. And it wasn't an expected death. This lady was in her 60s. So for me, it was about supporting the staff who were in shock at the time. But also for me, it was now dealing with that situation, having known her and worked with her for a year now, and working with the family, and then dealing with the sudden end of that relationship. So I felt I got supervision from my senior nurse, and it helped me to come to terms with that, as well as not carry the burden of that bereavement I was going through when I got home. So I think it's quite good to have that, work-life balance, but not to ignore the fact that our work can sometimes affect our home balance as well.
As a mental health nurse, since qualifying, I've always ensured that I always received consistent clinical supervision, because just as from the time I finished my training, it was always embedded in me that as a clinician, to be a good nurse, you need to be continuously reflecting on your practice. And so I've always ensured that I had that clinical supervision. So from being a newly qualified nurse on the ward and struggling to adjust from being a student nurse to a newly qualified nurse, I would ensure that anything that was, which I was finding difficult, I would take it to my clinical supervision sessions and talk through them with my supervisor, and then I would get the appropriate guidance and reassurance as well that I was doing okay, which was quite important for me. And I remember as well moving from an acute inpatient ward into home treatment, whereby I thought I was quite experienced and I was confident, but working in home treatment, I began to have all these anxieties about the risk when visiting clients in their homes, and they are quite depressed, and they tell you that maybe they want to end their lives. And although I knew that I did have the right skills, I would leave thinking that have I said the right thing? Are they going to be safe? So I had those anxieties, but I had a really good clinical supervisor who was an experienced home treatment clinician. So she would sit with me if I had any cases that I was quite anxious about, and would look back, she would ask me, so what did you say to the client? What plan did you put in place? And then through that reflection, she actually reassured me that I was doing the right thing, and I was able to perform my duties quite confidently. So I always think that it's important as clinicians, we need to have clinical supervision, because sometimes we do question ourselves, are we doing the right thing or not? But clinical supervision does give you that reassurance. And if there is something that you're struggling with, clinical supervision identifies that, and you are able to kind of work on how you can improve on that. So I think it's really important that everybody as a nurse does have clinical supervision, not just for the improvement of patient care, but for our well-being as well, because just having that platform to kind of ventilate, it's very reassuring, and it ensures that you are not keeping on ruminating on things, and then maybe you end up getting stressed. So you perform well in your duties, you provide good quality care, at the same time you are happy in your job and you enjoy doing your job.
Thank you very much, Bertha. Just talk me through how you think this development programme might influence other mental health nurses to sign up to to clinical supervision?
I do believe that after maybe going through the training, sharing with them, there's a possibility that some of them will change the way they normally practice or the way they regard supervision. Using my practice especially, there's kind of, we don't have a system that kind of will monitor the way we do supervision. So it's kind of a voluntary thing as opposed to whereby people can say that this is kind of I need supervision, I need to be supervised. So I believe if I share with my colleagues, they'll regard this as part of their day-to-day work. It's like saying, okay, if I don't go to work, I won't be paid. So if I don't have supervision, I'll be maybe having difficulties in managing my clients at the same time helping my colleagues to manage the clients. So that's the way I see it, yes.
Us as nurses tend to be the ones who are the frontline staff involved in those incidences, but there tends not to be an afterthought as to how we then deal with our own emotions and our own stresses of dealing with those situations to the point that it doesn't then affect us when we leave home. People tend to have this inbuilt that, oh, it's not going to affect me, but in the long run, when you're exposed to so many, difficulties, it will somehow start to affect your work, your performance, your concentration. For instance, I work in older people where there's a lot of challenging behaviors, and you can see as an external person how the staff are affected by someone who punches them all the time. Their approach becomes quite different, and how they manage, that situation becomes quite different. But until you point it out and until you recognize it, that's when people are able to start reflecting and thinking, actually, maybe I am finding this difficult to deal with and I need the support. So I think that's the reason why I felt quite strongly that it's a very important program for all of us to start working towards being better, but being able to reflect on what we do and how we do it.